Welcome to Patient Management and Delegation, a digital assignment by Healthcare Learning Innovations. Non-physician healthcare professionals are playing an increasingly important role in patient management and care coordination. To assist current and future nurses in preparing for that increase, this digital assignment provides a concept-specific virtual practice environment for fine-tuning patient management skills like determining acuity, scheduling staff, delegating, and prioritizing care. Mastering these skills can positively impact efficiency, quality care, patient satisfaction, staff stress, and morale. The main menu for this activity provides access to 4 progressive levels with added functionality at the completion of each one. Level 1 must be completed before moving to Level 2, and so on. The scenario sets the learner up as if they are a charge nurse responsible for analyzing patient handoff reports, determining acuity levels, scheduling nurses with patients, delegating tasks to nursing assistants, and prioritizing nurse caseloads. Throughout the activity, the learner will have an opportunity to earn a number of achievement badges representing their successes in certain areas of the digital assignment. Once each level is completed, the user will be able to download a detailed report showing their achievements, rationale input, time spent, and final scores. We begin with analyzing handoff reports for acuity levels. We do understand that many organizations have their own process for setting patient acuity. This acuity section simply allows the learner to evaluate patient handoff reports and set appropriate acuity levels with rationale as an acknowledgement of their detailed review. They are then validated for their response and given an opportunity to make appropriate corrections before moving on to the next section. Patient management and delegation reinforces the idea that keeping nurses happy should be a top priority for healthcare managers. In the scheduling section of this activity, nurses are provided efficiency and star ratings representing experience. As the learner begins to populate each nurse's caseload, the satisfaction of the nurse may change if they feel they are being overloaded with too many high acuity or time-consuming patients. The learner continuously makes adjustments to the schedule by moving patients around to different caseloads, by analyzing patient acuity levels, estimating how much time the patient will consume, and comparing that to nurse experience and efficiency ratings provided. The goal is to finish with all happy nurses. While scheduling patients with nurses, we show learners that delegating appropriate tasks to assistive caregivers can be an effective way to ensure quality care and achieve patient outcomes. Levels in this digital assignment that contain the added element of delegation are impossible to pass without properly delegating specific tasks to nurse assistants. There is one assistant that can be assigned to 4 different patients across all nurse caseloads. An assistant will decrease the amount of work the nurse has been assigned and impact the likelihood that the nurse is satisfied with the learner's proposed schedule. Once an assistant is assigned, the learner must provide rationale unique to that individual nurse's schedule. They must also recommend specific tasks that the assistant can take on to lighten the nurse's responsibilities for the assigned patient. Once the learner is satisfied with the schedule they've created, they will proceed to the prioritization portion of the assignment. There, learners will analyze the caseloads for each of the nurses they assigned in the previous step and adjust the order of patients according to the appropriate priority of care. After providing rationale for the priority order selected, the learner is validated for their response and advanced to the next nurse's caseload. Throughout this digital assignment, time spent, rationale, Badging achievements, and section scores are all tracked in a downloadable report. The learner has access to that report by clicking View Report on the main menu screen. The instructor also has access to the same report in the faculty dashboard. Thanks for joining us. Please contact Healthcare Learning Innovations if you would like a live demo.